I'm Lisa Saunders, and I'm going to share with you a PowerPoint I did based on my book, Help Childcare Providers Fight CMV, Protect Newborns from the #1 Birth Defects Virus. That's me. Today you're going to learn about congenital cytomegalovirus, or CMV, and the birth defects it can cause. You'll understand the recommendations for child caregivers and teachers from the American Academy of Pediatrics. You'll realize caregivers and mothers of toddlers are at increased risk for CMV. You'll learn how CMV is spread from toddler to toddler and from toddler to caregiver. You'll understand how hand hygiene protocols and avoiding bodily fluids, such as saliva and urine, can reduce transmission of CMV. You'll discover data from 5 studies on the effectiveness of CMV prevention education. You'll learn why it is important child care providers understand their increased risk for CMV. You'll find resources to educate women and families about CMV prevention. And that's a little cup my sister-in-law drew, just to emphasize that I'm your drink, please don't share me. So what is CMV? CMV, or cytomegalovirus, is a common virus. It was discovered in 1956. Between 50 and 80% of adults in the United States are infected with CMV by age of 40. Most infections with CMV are silent, meaning most people who are infected with CMV have no signs or symptoms. Infected pregnant women can pass the virus to their unborn children. When babies are infected with CMV before they are born, the condition is called congenital cytomegalovirus, or CMV. Congenital CMV is the leading viral cause of birth defects. According to the New York Times article, which is headlined, "CMV is a greater threat to infants than Zika, but is far less often discussed." It's a good article for you to Google and check out. Symptoms of congenital CMV, you can find those on the CDC's government website. Some babies might have signs of congenital CMV infection at birth, and that's premature birth, liver, lung, and spleen problems, small size of the head at birth, and small body size as well, and seizures. Some babies with signs of congenital CMV infection at birth may have long-term health problems. That's my daughter over there on the right. She did have that. She had hearing loss, vision loss, intellectual disability, small head size, lack of coordination, weakness or problems using muscles, and seizures. How is CMV spread? Sharing drinks, food, or utensils is a mode of CMV transmission. Contact with the saliva or urine of young children is a major cause of CMV infection among pregnant women. Person-to-person contact, that's kissing, sexual contact, getting saliva or urine on hands, and then touching eyes or the inside of your nose or mouth. Blood transfusions and organ transplantations through the breast milk of an infected woman. Toddlers in group care spread infections such as CMV. Toddlers put each other's toys in their mouths. They need adults to wipe their noses, feed them, and change their diapers. 44 to 100% of 2-year-olds in group daycare are excreting CMV or shedding it. Children cared for at daycare or in preschool exhibit a 2 to 3 times greater risk of acquiring infections. Group care in numbers. There are more than 500,000 child care workers in the United States. 61% of children under the age of 5 are cared for in a child care facility. And because of these large numbers, that's why it's so important that child care providers be educated. Child care workers and mothers of toddlers are at greater risk for CMV. 80 to 20% of caregivers or teachers contract CMV infection every year, according to the American Academy of Pediatrics. Mothers of children in group care are at increased risk for CMV. According to Dr. Demler-Harrison, quote, approximately 1 to 4% of all pregnant women will experience a primary CMV infection during their pregnancy. If you work in a child care setting, the risk increases to approximately 10%. If you have a toddler at home who is actively infected with CMV and shedding CMV in their saliva or urine, the risk is even higher, approaching 50% in some studies. Quote, increasing risk perception is important because providers may not be concerned about taking measures to reduce the probability of infection if they feel that they are at low risk, according to a study published by Thackeray et al. In 2016. The American Academy of Pediatrics states that staff of childbearing age who care for infants and children should be provided the following information. And this is, quote, the increased probability of exposure to cytomegalovirus, CMV, in the childcare setting. Female employees of childbearing age should be referred to their primary health care provider or to the health department authority for counseling about their risk for CMV infection. This counseling may include testing for serum antibodies to CMV to determine the employee's immunity against CMV infection. Since saliva can transmit CMV, staff should be advised not to share cups or eating utensils, kiss children on the lips, or allow children to put their fingers or hands in another person's mouth. How can CMV be avoided? Wash hands often with soap and water for 15 to 20 seconds, especially after wiping runny noses, changing diapers, picking up toys, etc. If soap and water are not available, use alcohol-based hand gel. Use soap and water or a disinfectant to clean hard surfaces that have been contaminated by secretions. Don't kiss young children on the lips. Don't share food, drinks, or eating utensils with them. Pregnant women working in childcare facilities should minimize direct exposure to saliva, but hugging is fine. The Centers for Disease Control and Prevention states, women may be able to lessen their risk of getting CMV by reducing contact with saliva and urine from babies and young children. Some ways to do this are kissing children on the cheek or head rather than the lips, and washing hands after changing diapers. These cannot eliminate your risk of getting CMV, but they may lessen your chances of getting it. This is what other countries are doing to handle the problem of CMV in daycare. In Queensland, Australia, they relocate workers who are pregnant or who expect to become pregnant to care for children aged over 2 to reduce contact with urine and saliva. In Germany, based on the German maternity protection law, to protect daycare workers from primary infection, their CMV serostatus must be checked at the beginning of their pregnancy. When the daycare worker is seronegative, she is excluded from professional activities with children under the age of 3. Research studies on CMV prevention. In a New York Times article in 2016, they summarized a 2004 CMV prevention education study. Quote, pregnant mothers shown a video and offered hygiene tips were much less likely to get CMV, 5.9%, than those not given information on prevention, 41.7%. In 5 CMV prevention education studies published between 1993 and 2015, they were analyzed in the article Prevention of Maternal Fetal Transmission of Cytomegalovirus. Quote, in each report, the efficacy of hygienic precautions has been greater than 75%. In another study, according to Dr. Demler-Harrison, she says, studies have shown that women who know they are CMV seronegative, know they are pregnant, and know their toddler's CMV shedding are the most likely to prevent CMV transmission and reduce their risk from over 50% during pregnancy to a risk of less than 5% during pregnancy. Dr. Demler-Harrison is the director of the Congenital CMV Disease Research Clinic and Registry. Now, my daughter, Elizabeth Saunders, was born with congenital CMV. When I was pregnant with Elizabeth, I was unaware of CMV. I was at increased risk for it because I was the mother of a toddler, a licensed child care provider, and I volunteered in a church nursery. In 1989, Elizabeth was born. Her head was small and deformed, and that is called microcephaly. And you might have seen pictures of babies with small heads from the Zika virus. It's similar. I was told Elizabeth would never roll over or sit up, and she never did. I was told Elizabeth would never speak. She never did. This is 2005, and Elizabeth's 15 with her big sister. This was on our last family vacation before Elizabeth passed away. In 2006, Elizabeth died during a seizure at age 16. In 2010, a grandmother contacted me to ask about CMV because her grandson was born with congenital CMV. The grandmother wondered why the baby's mother, a high school student, was not educated about CMV before interning at a childcare facility. The nurse caring for the baby asked me to start a CMV education campaign. And I told her, and I've been telling everybody for years, CMV families, doctors, and researchers have been trying for years to raise CMV awareness. We really need the public's help to raise awareness. If I had known about CMV before trying to become pregnant with my daughter Elizabeth, I would have, and by the way, that's me, I would have asked my doctor for a blood test to determine if I had a primary CMV infection. If I did, I would have waited to get pregnant. Because I had a miscarriage before I got pregnant with Elizabeth, and that would have been certainly a good time to be tested for CMV to see if that's why I had the miscarriage. If the blood test showed I had never had CMV in my life, I would have declined to volunteer in our church Sunday school with children under the age of 3. I would have declined to care professionally for children under the age of 3 in my home daycare center. I would have practiced careful hygiene with my own toddler. I would have not shared food or cups with her or kissed her near the mouth, and I would have washed my hands every time I fed her, wiped her nose, picked up her toys, changed her diaper, etc. Finally, states are doing something to raise awareness. Utah was the first state to do that in 2013, and I'm excited to say that in 2015, Connecticut also joined the fight against CMV. They passed a law in, like I said, in 2015, and seen here at the office of the governor in Hartford, Connecticut on July 28, 2015, is Governor Malloy with medical professionals, parents, legislators, and lobbyists at the ceremonial signing for Public Act 1510, an act concerning cytomegalovirus. And I'm standing beside the governor holding a photograph of Elizabeth. And there is another child there who was born with congenital CMV. He's there in his wheelchair. So in summary, women who care for toddlers, reduce your chances of contracting CMV. CMV is a common virus that is shed by many young children. Avoid saliva when kissing a child. Don't share food, drinks, or eating utensils. Wash your hands often, especially after handling children's toys and wiping a young child's nose or drool. You will find flyers and other good resources at the cdc.gov/CMV webpage, and my blog features many resources geared specifically to childcare providers. I collect them from different states and put them on there to show you what they look like. And you can just go to congenitalcmv.blogspot.com.